survivors, but in the Indian context, I don't very much believe that the word survivor came up because of lots of problems which occurred in the United States. If you listen to all those narratives, whatever the two narratives I heard earlier is nothing at all. So to call survivor, personally, I don't think it is. Anyway, that's a different matter. Accountability at all levels, follow government response, additional responsibilities for the NGO, etc. Plan for integrating DMHP with the National Rural Health Mission. There are several advantages. Now I'm ending. I asked this question, are things okay in countries which have 100 times, today the health secretary referred to Australia. He said that they have so many psychiatrists, psychologists, nurses per 100,000 population, etc. I'll give you examples quickly of United States. This is a very, very recent book. I don't think it has come to any bookshops here, or it may have come. I picked it up about 6 weeks ago while I was traveling. The reason why this book I'm showing is this is written by not a psychiatrist, not a psychologist, not even a care and user, but one of the best known mental health advocate in the world who is living today. I'm referring to Rosalind Carter. This book is about how she herself became an advocate. When she first started, canvassing for her husband's governor election in the late 60s in Plains, Georgia. Later, Jimmy Carter became the president. He appointed the first President's Commission, where Rosalind Carter was very responsible. The second President's Commission appointed by George Bush, although Rosalind Carter was the first lady of a previous Democratic president, she had a major role. And this is a very interesting book. Within our reach, that is not the important thing. Ending the mental health crisis. This is as recent, this published in April 2010. And she, who is 35 years advocate for mental health in the United States, talks about the situation in the United States as crisis. I got a little confused. I looked at the dictionary, what is the meaning of crisis? You know what it is. What is this book? Rosalind Carter, former First Lady, describes a mental health system that continues to fail those in need. It talks about the billions of dollars which are being spent for mental illness, etc., etc. Great user organizations, movement, the NAMI, all that. Describes what can be done to transform the current system, which is totally in shambles. In shambles is not her own statement. A mental health system in shambles is the actual phrase used by the President's new Freedom Commission on Mental Health 2003. Again, in shambles means it is in complete disorganization. So with substantially higher resources, personnel, etc., things are not going on all right. Of course, that is no justification for our NMHP or DMHP not working. That is of course Rosalind Carter. You may not believe, at least the psychiatrist here, may not believe her. But what does the psychiatry editorial comment say? Archives of general psychiatry. Psychiatry faces one of the greatest public health challenges in contemporary medicine. Most people with mental disorders in the United States remain either untreated or poorly treated. Interventions are needed to enhance treatment. This is from Ron Kessler's famous study. Somebody in the morning said, if this occurred in the United States, within 1 week or 2 weeks, he would have been identified and managed. I have my serious doubts. At least Ron Kessler's study says that it may not have occurred. Now, this is the place where I am currently working. There also they use the word crisis. And here it is not just somebody writing in the journal. This is, of course, a Medical Journal of Australia editorial. But there was a Parliament of Australia Senate Select Committee on Mental Health. And what is the title of their report? A National Approach to Mental Health from Crisis to Community. I think that is a kind of sentiment that I sensed earlier. You're talking about asylum still, but when you should be actually treating people in the community, etc., etc. This is Australia, 2006. And Gavin Andrews, who is a very respected public health psychiatrist, not just in Australia, all over the world, he wrote an editorial, The Crisis in Mental Health. The chariot needs one horseman. What I remembered was what Vandana said in her morning presentation. The mental health lobby is talking in different voices. How can you ever get anything from the government or a minister or anybody if 10 different people are talking about 10 different things? So, Gavin writes about the mental health system in Australia, and he says it's like a chariot drawn by 6 horses, but each horse having a different horseman. What you require is one horseman so that you go in the direction. And he begins that article in the Medical Journal of Australia. How is that Australia's mental health services are in disarray? So crisis, shambles, disarray. These are not, the right kind of things which you expect to be much better. Anyway, closer home, a country like ours. This is what my secretary sent me there for yesterday. This is appeared. It's a big, extensive picture. It's a 2-page article in the West Australian, which is a paper in Western Australia, in the section Indonesia's mentally rotting chains. So the point I'm making is that we need to get disturbed. There are lots of questions, but it's a complex problem, and we need to collectively think and answer our questions. I am not at all a pessimist. I think we are going in the right direction. Lots of things have occurred compared to the day when I used to go to Bellary, and I'm, absolutely delighted with the kind of progress that is happening. We are certainly in this, not in this state. Maybe 10 years ago in Nirvadi, maybe such a headline may have been appropriate here too, but perhaps not now. I end my presentation with 2 quotes. One is from India. The major hurdle in the path of providing better mental health care to the community is not in the purse but in our minds. This is, I think, of a poet, but it is from the book edited by everyone. And the last one is that when you hear it, again, that is what, as I was noting down in my pad about the DMHP, the NMHP, the confusion, etc. I remember a quote, and this is something which I like very much. This is Edmund Burke, who is an Irish, Anglo-Irish philosopher, statesman, orator, speaker, writer, etc. He wrote lots of things about the French Revolution, the American colonization, etc. He was talking, of course, those days, but I think it is very relevant in many programs today. Those who carry public schemes must be proof against the most fatiguing delays, the most mortifying.
I feel that